Colleagues, friends, ladies and gentlemen from across the planet, welcome to this webinar. I'd like to start us off with an offering an acknowledgement in the native tongue of Emma and myself in Māori. So nō reira tuakau ki te mihi atu kia koutou e hohi mai nei I tēnei rā nō reira uku rangatira o ngā WFPHA nau mai harama tēnā koutou, tēnā tātou. Nā maunga whakarakaraka tū hono mai koutou. Nā tūpuna tū tonu, ki te taha uru o te wakatapu, ei toka ahuru, ei toka marino. Whakakapua mai e koutou o koutou kurawai hoka, o kia tau rahu, tihei mauri ora. Special acknowledgement for the various parts of our planet, our globe that you come from and that you are. I want to acknowledge those that are live with us now, and also those of you who will be picking this up later on at I guess, a time zone that suits you sensibly. I'm Adrian Patu. It's my privilege to chair the Indigenous Working Group of the World Federation of Public Health Associations. I'm coming to you from Tamaki Makaurau, from Auckland in New Zealand, and want to acknowledge our other panelists, Emma Waimari Rawson Te Patu, who's streaming in from Geneva in Switzerland, and also Alejandro, who's coming to us from Washington, DC. Well, I'll talk a wee bit more about our wonderful experts as we go through. So the plan of the order of ceremony, if you like, is we're going to take the opportunity, all three of us, to present some our thoughts and expertise around this particular topic in this particular webinar, Decolonizing Public Health Globally, Progress and Possibilities. We are going to take the opportunity after each of us have spoken to field questions from you. And so we invite you to offer questions in the Q&A. The backup team, who are based here and in Australia in real time, will pick up some of those and we'll be looking at them at the same time. So we have a window of 90 minutes. And the good news is we tend to fill that. So I'm looking forward to the privilege of being part of this particular group. So once again, I want to acknowledge your mountains, your rivers, your seas, your grasslands, your lakes, and all those places that are important to you and your peoples. I want to acknowledge the symbiotic relationship that we have with these places and the very long shadows of your ancestors and all the different, the tapestry of who we are as people in places on this planet. So welcome, and welcome. So this particular webinar is around open discussions of the importance of decolonization to the global public health. And it's been brought to you by the Indigenous Working Group of the World Federations of Public Health Associations. So I'm actually going to give you a bit of context about and the brief history about how we came into existence, where that aligns up, and then basically that'll take us to being able to acknowledge and introduce the presiding member of the World Federation, which is Emma. And then part of that we'll be talking about the connections and the associations and the links that have been happening. Okay. So for those of you who've heard me give this descriptor, I just want to thank you for your indulgence as I give a kind of a description of what indigeneity looks like, so we can bring it contextually back into this point and this intersection where we meet. I'm going to begin by just acknowledging that a very broad description of public health is an intersection between health and education. So that's kind of where we meet. One of those things about Indigenous folk is that we know that if there's an intersection where Indigenous people globally meet, is that we generally live shorter, sicker lives than most of the people in our various constituencies. And when I say constituency, I mean the nations or nations within nations, all places that we live in those spaces. One of the ways to describe indigeneity and Indigenous folk is that there are kind of three kind of faces of indigeneity. By far the largest population of Indigenous people, and can I say there are 500 million people globally who freely identify as being Indigenous, whatever that means to them. And those 500 million people are recognised by the United Nations. So there's a recognition and reinforcement at a global organisation relative to their place to identify who they are. By far, the majority of the 500 million people who identify as being Indigenous live in the global south. So, of course, those are people who live outside of those of us that live in the global north, which is essentially the OECD and developed or wealthy countries. So they probably represent maybe 480 million, by far the largest. The group that a number of us belong to, and particularly in the working group, are what some of us would refer to as fourth world, as Indigenous people within the developed countries of the world. And so they're conspicuously people like Māori, like myself and like Emma, from Aotea, New Zealand, Aboriginal and Torres Strait Islanders, Indigenous people from the Commonwealth of Australia. Conspicuously, there are those from North America, so the United States and Canada. So, of course, the two significant groups of Indigenous people in that sense in the United States would be Native American, Native Alaskan, and Native Hawaiian as those particular groups. And then we've got those in the Arctic Circle particularly, and the Sami who actually exist within a number of countries and jurisdictions from Russia all the way across to Norway and Sweden and Finland. So the Sami Nor. And then another group that's a bit quite conspicuous are those, particularly in more recent news pieces, is Greenland. So technically they are also Danish nationals. And so they have a very high proportion of Indigenous people in their physical jurisdiction of Greenland. So they probably represent about 83% of the population there. And they are ethnically Inuit who connect in both from the Bering Sea all the way through to the other side across the Arctic Circle. And then there's a kind of a third group, and the third group really are Indigenous, sovereign nations who essentially exist as Indigenous people. So they might be places in the Pacific. It's very easy to pick them as places like the Kingdom of Tonga or actually Samoa or Fiji are easier ones. And so where that kind of fits is they have sovereignty and they have a kind of ideal that many of us would want to have. But almost all of them have also been influenced and fashioned in some way with the intent of colonization. In fact, most European, so the United Kingdom, particularly Britain, France, and other places, didn't really start to decolonize until the mid-20th century. And so that's a part of that whole space. So there we go. Can I also acknowledge that about 40% of those who identify in Indigenous terms live in the People's Republic of China and also in India. And I think it's important as leaders in this Indigenous public health space that we acknowledge that no Indigenous people are formally recognised in those countries, partly for political reasons and the other part for traditional cultural reasons in terms of Indigenous as a kind of a jargonistic word seen by some of them, given that they represent castes and other definitions of people. Can I also acknowledge in this space, one of our wonderful panelists is actually quite an unusual person himself, because he is in fact represents a significant part of the Mesoamerican populations that live all the way from Nicaragua or from Mexico South, all the way through to Brazil and so on, of people who are actually descendants of those who arrived from mainly Spain, but also are also Indigenous people. So the incredible tapestry that exists within this Indigenous space. So there's that. I'm actually using my time just to do this context stuff. And my next piece that I'm going to allude to is the fact that the World Federation was established in 1967. In 2016 was the first time they formally had an Indigenous person on the Governing Council. The Governing Council represents over 100 countries in terms of their membership. There are public health associations. I'll leave some of that for Emma to describe. And so we, from a global public health gathering in Melbourne, in Australia, a yarning circle, an opportunity for people to sit around and have conversations and narrative. I was given as a member of the Governing Council a mandate from Indigenous folk and also non-Indigenous allies and supporters from across the globe to petition the Governing Council to establish a working group. So we are one of essentially 9 working groups, and so that happened very quickly. So I want to acknowledge very briefly that the Federation bravely accepted, and quite rightly accepted, the creation and adaptation or the arrival of an Indigenous working group. In most global organisations like this, it takes many years, in fact decades, to give recognition to Indigenous people at an executive level in the space. So we're really, really happy. One of the plans in that space was that one day we would have an Indigenous person as the presiding member, as the president of our federation, and that has manifested itself in the nomination of Emma, who is present today as not only the first Indigenous president, but the first Indigenous woman president of our federation. And so her tenureship is 2 years as a president-elect, and then 2 years as the president. Very soon, in 1 month's time, her first year in that space will be completed, and then she'll have 1 more year as the president, and then there'll be a couple of years as to give continuity to these important roles as the immediate past president. I'm really excited about Emma being able to talk to you about the progress, and also alludes to the possibilities that she's been involved in, not only in the last previous 2 years, but the incredible light speed and halcyon speed that she's been working at, particularly since last year. And so without further ado, I think that's enough context. I'm just looking to see if that makes sense to our other 2 panelists. I can move forward now. Okay. So again, thank you to our participants, and congratulations for being here in live, and welcome to those who will be watching this from the recorded space. So I'd like to, in saying that, acknowledge Emma, and in saying so, Emma Rawson Te Patu. She can give her tribal affiliations, but she is from Aotea, New Zealand. Emma is a director of Manukau Associates, an Indigenous consultants in this space based out of New Zealand. She is also one of the founding members of the Indigenous Working Group that I alluded to, that had its formation in 2017. She has a Master's of Philosophy with honours, first class, focusing on institutional racism and public health. Emma is an expert advisor and recently contracted to the World Health Organization, and has been a consultant to the New Zealand Human Rights Commission. Emma has a passion in developing training frameworks and dismantling institutional racism, supporting culturally responsive human rights-based public health and approaches. I want to acknowledge the time, particularly that she's been in the Northern Hemisphere in the present time. She's been zooming in and out across the Northern Hemisphere with a lot of stuff going on, making links, making connections, and extending the influence of the Federation, but particularly giving presence as an Indigenous woman leader, particularly in public health. So, tēnā koe, Emma.
Tēnā koe, Adrian. Tēnā koutou, tēnā tātou katoa, tēnei te mihi atu kia koutou, kua tai mai I te pō, I te aiai, I te ata rānei, ko Waio, ko Ngāti Ranginui, ngai te rangi raukaua me Ngāti Haua, ko Emma Waimari Rawson Te Patu tōku ingoa. So good morning, good afternoon or good evening, wherever you might be in the world. I see there's a great muster online from Aotearoa, New Zealand, so kia ora whānau. It's really great to be able to be here with you on this iteration of Global Public Health Week 2025. Was really pleased to have our opening ceremony yesterday for Global Public Health Week, this whole week dedicated to decolonising public health. It's a world first for the Federation to hold a whole week of events under this banner, and it's my privilege to be here to speak to you about how we got to this place as a Federation, what we're currently doing, and then what we are aiming to do as we move forward into the future, as Adrian has said, with this incredible opportunity of having the office of the President being an Indigenous woman from Aotearoa, New Zealand. So kia ora everybody, great to be here. And I might just go back a little bit and give a little bit more information around who the Federation is, because for me, in talking about decolonising global public health, it's really important that we recognise the role of allies and mainstream organisations that lean into understanding how they can understand what it means to decolonise anything, and then what the actions look like and how they can support and encourage more of these actions to happen all around the planet. So, as Adrian said, the Federation began in around 1967. It was originally situated in Washington, D.C., and hosted by the American Public Health Association. New Zealand was one of the founding members alongside Canada, the UK, and Australia. So we have been very proud to have been involved in the Federation since its beginning, and have been in and out over time. And very significantly, again, as Adrian mentioned, since 2016 with the first Indigenous person on the Governing Council for 2 consecutive terms, and then now with myself being able to be in this position of leadership. The Federation represents around 5 million public health practitioners across the planet, from around 115 public health associations, so that means 115 different countries. We also have a number of different member organisations of different types of members. The organisation that Alejandro, who is here on the panel with me tonight, represents, the Indigenous Determinants of Health Alliance, is our very first fully Indigenous organisation to join as an associate member. So we're very, very proud to have this as one of our newest members, and also one of our closest working partners with the Indigenous Working Group in terms of driving forward our agenda to decolonise global public health and other spaces like the UN. So that's a little bit more about the Federation and who we are and the size of us. I think it's really important that you understand the type of impact the Federation has. So we have a seat on the Executive Management Board of the WHO. That means we are a civil society that has the ability to give direct recommendations to the Executive Management Board of the WHO on anything public health. So again, this incredible opportunity to be able to centre Indigenous ways of knowing, doing and being within a federation like this one, within an organisation like the WHO, is very unique. And again, it's a huge opportunity for us to be able to ensure that the right things are happening in the right way for our Indigenous populations around the planet. So again, as Adrian has alluded to, I've been doing a lot of travelling, a lot of speaking, which really speaks to the appetite around decolonising public health that is truly growing, and we're seeing it very clearly. And it's very interesting given the nature of the political environment sort of all around the world, that we are seeing this appetite continue to grow. This means that people and communities and public health communities and other professional communities, those people that are really focused on the well-being of the populations of our planet, are leaning into this space in a really, really good and authentic way. And again, this is why we pay so much attention to highlighting the work and the commitments of the Federation, because in many ways they had no need to lean into this space. But it was exactly about the work of allies that ensured that we were able to be at this table and be able to sit and work with these 5 million members, the members of all of our associations around the planet, to help to support them to understand what it means to decolonise public health, and therefore understand and lean into actions that can actually create transformational change. So here is, I guess, the very beginning of how the Federation has begun to actually embed into its skeleton, I guess, its commitment to decolonising public health globally. And those of us that work in this space know how important it is for mainstream organisations to not only talk about these issues, but embed the practices within the foundations of the organisations, but also within policy, and then also in action and education within the organisation and those working with it, for it, and about it. So I really like to point to goal 2 in this slide, which is the goal that we adopted last year at the General Assembly of the World Federation, which is contributing to promote systems change and decolonising public health. And I would posit that we are the first mainstream organisation of our kind globally to have a goal of this nature so far high up in its priorities, of course, following on advocating for peace as the number 1 goal. So again, this is about understanding as an organisation how and what are the most important actions to undertake. So this is the embedding part, the ensuring that we are demonstrating leadership to our associations, to our organisation members and our partners, that this is how true change happens, by ensuring that within the nature of the beast, everything is founded on a decolonising methodology. So here is a little bit more about the details that I've sort of been touching on in terms of the program of work that the Indigenous Working Group has been leading and supporting and helping the leadership of the Federation to understand what needs to happen. And so we've been helping to support a strategic plan that aligns itself to understanding a decolonised public health. So you've just seen the goal number 2 that was adopted last year. We've worked on building a working definition of what it means to decolonise public health. And when I say this, I need to be very clear that we have to be really clear as an organisation, as a federation, who we are and who our membership is, and thinking about that definition so that it was one that our membership could understand and adopt and lean into, and then be able to work within their own organisations so that they were able to explain and use and then build actions from that definition. I will speak to that definition very shortly. One of the other commitments that we have made in terms of supporting actions for true transformational change is the creation of tools and resources to help support this understanding of the definition of decolonising public health for our members and the broader public health community. And not only our members in the broader public health community, but all others that are interested in this area of work, because again, those of us that understand and know this work know that decolonising anything really, the central steps are very similar across all sectors and in all spaces. It's about the time taken to understand the context and the nuance for each of the different spaces with the same recipe, if you like. So one of the other main things that we have focused our efforts on over time, and again, I just want to acknowledge Alejandro and our friend Jeffrey Rock, who also leads in the Indigenous Determinants of Health Alliance space, that it's been very important for us to grow relationships and partner with others, because we all know that this is a huge lot of work, and that when we think about the number of Indigenous people on this planet, there's only 6% of the population Indigenous peoples. That means we need partners, we need allies, we need other people who understand what it is that we need so that we can work strongly together in partnership in order to get more action faster all of the time. So one of the other things that we've also been encouraging and want to encourage more of, so within the Federation, one of the biggest movements for creating change or creating projects and seeing work happen across our membership associations are our working groups. So as you know, this is being hosted by the Indigenous Working Group this evening. We have probably another 9 different working groups within the Federation: oral health, young professionals, environment and climate change, public health education, and a number of others, women and maternal health. So I say these because these opportunities for all of you on the call, if these are things that you're interested in, to lean into, perhaps, asking some questions of our office about how to join. The website link is at the end of my presentation. And we, of course, would like as many Indigenous peoples as we can have to join, not just the Indigenous Working Group, but the other working groups of the Federation, as a mechanism to ensure we have Indigenous knowledges in the centre of all of the main areas where we are actually getting work done. It's really important to note that a number of our working groups are working directly with directorates within the WHO. That means that's another impact point for us, particularly if we have more Indigenous voices in our working groups, to have impact directly into the work of the WHO. Again, the three of us that you can see on your screen right now have been central to the recent and not yet released global report on the commercial determinants of health. We have been able to review the entire global report, as well as provide a background paper on Indigenous determinants of health in regards to the commercial determinants of health. Again, something that has not happened before in the way that we were able to do this piece of work for that particular area. But very important that I just put this draft definition of decolonizing public health here so people can see what we've crafted, and just want to note that it was our very first intern, actually, Ariana Andrews, who did the work on this piece for us, and this again is another opportunity that is available to people on the call. If you are interested in this work, we have internships through the Federation that we are able to discuss with you. They can be done in a number of different forms. And of course, as Indigenous peoples, we know that our contexts and situations are often different from others. So we have some flexibility to do things in a way that accounts for our very busy lives and schedules. So if you are interested in thinking or talking about that, please reach out to Adrian as the chair of the Indigenous Working Group, and we'll be able to start discussions about possibilities around different kinds of projects that interns are able to do. So here's our definition. Decolonization is an individual and collective process that involves actively resisting forces of colonialism that perpetuate the subjugation and or exploitation of Indigenous minds, bodies and lands. Decolonization in public health takes many forms, including revealing and analysing the historic and contemporary impacts of colonization. This therefore includes overturning colonial structures that perpetuate inequities in health and the determinants of health in realising Indigenous liberation, self-determination and well-being. When you see, I think it's our Indigenous health policy position statement that we were able to have signed off at the General Assembly last year. This contains, I believe, this definition. If it's not in that one, it will be in the Decolonizing policy position statement that's going to the General Assembly this year. Again, really important to note that our membership was really at the beginning of its journey in understanding what we're talking about when we talk about decolonisation. And so we needed to come up with a really clear definition for our members about what we meant when we talked about decolonisation, and that we're centering indigeneity at the beginning of the story where it belongs. Because if we don't acknowledge that, if you don't start with decolonising in regards to Indigenous peoples, we will not be starting in the right place, and recognising that there are many nuances to this conversation and the people affected by this conversation, but this is the place that is often overlooked, shall we say, and for a start, in a place that seems more obvious. Okay, this is just a little bit more about the policy position statement on decolonising public health. So just for, again, some of you on the call who might be at the World Health Assembly this year, the Indigenous Working Group is partnering with the World Federation and a number of other groups, including the Indigenous Determinants of Health Alliance, including the Planetary Health Alliance based out of Johns Hopkins University, including the WHO Commercial Determinants of Health Directorate, including the Global Alcohol Policy Action Group and the Indigenous Caucus of the Global Alcohol Policy Action Group, and Te Rauora from Aotea, New Zealand. We will be delivering a masterclass on decolonising public health on Monday the 19th of May at the World Health Assembly, as well as 2 other side events on the Saturday the 24th on the commercial determinants of health and the Indigenous determinants of health, and one on lived experience in alcohol and addictions and mental health, with all of those partners or some of those partners in all of those 3 side events. This again is another major opportunity for us to have impact and to invite decision makers and change makers and those people directly in the WHO who can make significant difference for our peoples across the planet to come and listen to our Decolonizing Masterclass and be part of discussing this policy position statement on decolonizing public health. Decolonizing actions and opportunities, which is really the title of this particular webinar, was actions and commitments, or actions and opportunities. So you've had the story so far. I just want to acknowledge also previous members of the Indigenous Working Group like Dr. Summer May Finlay and Dr. Carmen Patu, who were at the very beginning of the Indigenous Working Group and with us for a significant period of time in the creation of the work that we've been able to lead out and continue to lead out on. I have mentioned our significant relationships globally with both Indigenous groups and other allies. Also, the alcohol policy position statement that will go forward to the Governing Council, the General Assembly this year, and the decolonizing policy statement that will go forward to the General Assembly this year. Our 3 side events that we'll be hosting in May, end of May this year. We're also doing quite a lot of work around mapping the work that we have been doing, that we are doing, and that we will be doing, and aligning that mapping with the strategic goals and actions of the Federation, so that this is another point of embedding the work that's being done, so that it will be inside the workings of the organisation for the rest of its existence. So working with Associate Professor Lee Kamori-Haynes, who's helping us to significantly capture and illustrate the significant body of work that we all collectively have been doing over the last nearly 8 years and will be continuing to do for some time to come. I've also mentioned the interns and the opportunities to become an intern of the Federation, either a main Federation intern or an intern of any of the working groups. So those are the possibilities there. Again, reach out to Adrian, and the links are at the end of my presentation. And there is a lot more going on. I am traveling the world for the next 6 months to 8 months at many speaking engagements all across the planet, all focused on decolonizing global health. So again, the appetite for this conversation is there. I know often it doesn't feel like that, and I know speaking to our friends and colleagues back home in New Zealand that there are significant challenges there at the moment in regards to Indigenous human rights, as there are all over the world right now. So acknowledging that, but also acknowledging that there is a lot of positive change and a lot of positive conversation. Anyway, there's 3 quick QR codes there with more information. Adrian's address, so you can communicate with him. Oh, our LinkedIn page is the other one, the Indigenous Working Group LinkedIn page. So please feel free to join us on that page and stay up to date with all of the work that's happening and all of our friendships and partnerships across the planet. Nō reira, tēnā koutou, and back to you, Adrian.
Tēnā koe, Emma. Ko tēnei te mihi atu kia koe. Hey, thank you very much. If you look behind our other 2 panelists, you'll see what represents probably a third of a beautiful taonga that was gifted to us by Robin Kohukiwa, one of our artists from here. She was actually Australian-born New Zealander and also is whakapapa Māori. And so Emma communicated with her years ago in the formation of our working group, and she wonderfully and graciously gifted us this taonga that represents. And there's something interesting about it, because it's kind of like, if the narrative, the kōrero, the stuff that we're talking about is transcultural, so is this beautiful piece that was gifted to us by this taonga, by this really important person who's also an artist. When Emma alluded to interns, people often think they tend to be young interns. Look, we're an Indigenous organisation. Youth, and the definition of youth and whatever leadership and that varies for us compared to Maine. So we are interested in interns all shapes, sizes and colours, if you know what I mean. Okay. Also on the links, you'll see the previous webinars that we've run. And I also want to acknowledge those who are tuning in from Aotea, New Zealand, and so on. Okay, so look, it's quite wonderful to have the opportunity to introduce a colleague and a friend of the working group and a member of the working group, someone who Emma introduced me to recently, having met him in New York, and we've also had the opportunity to spend some time in Washington DC. So Alejandro Bermudez del Villar serves as Cedar Rock Alliance International Advisor on Global Indigenous Systems and Platforms based out of Washington, D.C. I just want to also acknowledge my brother, all the tension that's going on in the space of with the leaning right and the influence that has and the loss of significant numbers of leaders, both in a functional role, but also true leadership roles and executive roles, also across basically out of DC. And I want to acknowledge the tension that exists in that place for you as a servant of the people and the peoples. Of course, Alejandro is obviously bilingual plus. Works for non-profit organisations for over 20 years, experience leading and managing public health, equity and technology grants and contracts from the Indian Health Services. And so I want to acknowledge you. You can talk a wee bit more about the significant organisations and links that you bring. And I also want to just acknowledge on a professional note the wonderful opportunity that I know that Emma and I have and take, and others around the sophisticated tapestry of world knowledge around the lay of the land, particularly in the Indigenous space. So tēnā koe mai hara mai. Welcome, Alejandro.
Thank you. Thank you very much, Adrian. And thank you for the preparation and Emma for inviting me. Again, thank you very much for that presentation. My name is Alejandro Bermudez del Villar, and I'm originally from Mexico. I'm based in Washington, D.C. And in addition to working for Cedar Rock, I also coordinate the Indigenous of Health Alliance, which I am going to be briefly telling you about, and the work that we have done in partnership with the World Federation of Public Health Association. Which is one of the closest and most important partnerships that we have. So I'm going to provide you with a brief overview and background on the Indigenous of Health Alliance. It is an Indigenous peoples organization. It is non-profit. It has been registered as a non-profit. It is 100% led by Indigenous peoples here in Washington, D.C. The goal is to foster culturally safe systemic change globally through the adoption of the UN Permanent Forum on Indigenous Issues, Indigenous Terms of Health framework. It has been sponsored by the members of the forum, and that's what we have been using in order to advocate precisely for decolonized structures. So by nature, it is a decolonized frame. It is grounded on the UN Declaration on the Rights of Indigenous Peoples and the free, prior, and informed consent principle from the declaration. The framework is centered around indigeneity, which is basically the circumstance of being indigenous with the wonderful knowledge and ancestral wisdom, as well as with the challenges Indigenous peoples face on an everyday basis or every day. And this is grounded on the 2023 study that we started. The Alliance has 35 members among Indigenous researchers, leaders, advocates, politicians, and community leaders from the 7 Forum Social Cultural Region. It is based in Washington, D.C., and as I mentioned, we are a proud member of the World Federation of Public Health Association, as well as the Planetary Health Alliance. We have partnered with the Federation on the work with the WHO, or the World Health Organization, the Pan American Health Organization, and other organizations as well. We have also done joint presentations of these studies that I will be presenting you today at the forum, at the Expert Mechanism on the Rights of Indigenous Peoples, at the Convention of Biological Diversity, and other venues and forums. So the framework is comprised of 3 studies sponsored by the Indigenous Forum on the Forum of Indigenous Issues. It was created as a response to the apathy, lack of education, and systemic shortcomings that the UN agencies show regarding Indigenous health. So it has a unique approach that is focusing on institutional systemic issues at all levels and has the potential to expedite changes needed. So that's where we're trying to work on. It provides tools and guidance on concepts, operations, and assessment of institutional adherence to Indigenous rights and cultural safety. Actually, the latest study that we created does this evaluation of agencies. I will be showing you briefly in a second. It has been recommended, the framework has been recommended by the forum to be adopted by all the UN agencies as a culturally safe framework for approaching Indigenous peoples based on Indigenous rights. The studies were developed and expanded by 35 Indigenous researchers, as I mentioned, from different sociocultural regions of the world. It has already been adopted by the National Indian Health Board, the National Congress of American Indians, and the Cook Hill Tribe. It has been featured in different journals, including The Lancet, which is quite relevant here in the US and I think globally. Open Access, which is also a UN-based journal, and Health is a Political Choice, which is co-sponsored with the European Union. The World Health Assembly Executive Board recommended the concept of indigeneity, and this is something that we have been working with the Federation on as the determinants of health. Just the concept was included in the Social Determinants of Health Equity Report, which is going to be released this year. Also, we're very excited that the framework has been incorporated as a reference document in the Convention on Biological Diversity's Plan of Action, which is very relevant because that we can leverage a lot of work through that inclusion. So that is the overview. And I'm going to be providing you very quickly with what the framework is. As I mentioned, it is based on 3 studies. The first study introduces indigeneity as a key determinant of health. It identifies 17 protective and 16 risk factors that influence Indigenous health and outcomes. That is, the circumstances that are specific to Indigenous peoples and that influence Indigenous health outcomes. It guides institutions to create culturally safe, right-based health policies and programs. As I mentioned, it is based on or grounded on the UN Declaration on the Rights of Indigenous Peoples, and is divided into 3 specific categories, which is intergenerational holistic healing. That is also an approach that the organization takes for the work that we do. The health of Mother Earth, that deals specifically with the environment, ecology, and everything that has to do with nature, breathing or non-breathing, all of the elements, and decolonization and re-indigenization of culture, which is what we're trying to accomplish, and we're working on and partnering with the World Federation of Public Health Associations as well. So the second study was the conceptualization of the operations. It actually translates all of these Indigenous determinants of health factors into practical applications across institutional systems, that is offering step-by-step strategies for agencies to foster accountability before Indigenous peoples and systemic change rooted in Indigenous rights. The areas that we approach, in practical matter is representation and decision-making. There has to be a substantive and meaningful inclusion and incorporation of Indigenous leaders in all of the decisions that agencies are making. To include meaningful approaches and interventions for Indigenous peoples, and then self-determination in evaluation, data collection and incorporation of holistic Indigenous methodologies. So that is all the programming that is being done and the research that's being done within the agencies. The last one is, not the last one, but the care for Indigenous lands and management of nature and natural resources. So that is another area. And the last one is just involvement in policy processes. Basically, to involve Indigenous leaders, not in an itinerant manner, but rather throughout the whole policy cycle. So those are the areas that we approach in practical manner with the second study that was made in 2024. And I'm happy to go through questions or any discussions that we have after we finish. And this is the last study that we actually just released in March, and it's going to be presented at the UN Permanent Forum on Indigenous Issues. This is an institution evaluation study that was created just recently. It measures the alignment of the entities with the cultural safety needed, equity, and Indigenous rights. Basically, we are assessing or evaluating, measuring how well agencies, it could be UN agencies, ministries, any institution, how well they are doing in regards to indigenous people's programming or policies. And it provides an opportunity to fill the gaps that, like mainstream frameworks, which overlook usually holistic nature of indigenous health. So it was developed collaboratively by indigenous leaders as well. And it is designed to reflect community-specific needs, cultural values, and systemic barriers. This study includes a tool, which is basically a scorecard. It's organized in 20 items across 4 sections, which are intergenerational holistic healing, health of Mother Earth, and decolonizing culture, which is what we saw in the first study, as well as institutional compliance, which is what we reviewed on in the second study. So basically, we will be assessing in a conceptual manner, in an operational manner, and rights-based manner, whether agencies or institutions are approaching indigenous issues in a proper manner and based on the rights as vested in the Declaration on Indigenous Rights from the UN. So each item is rated on a scale from 0 to 3, with total scores offering a benchmark of institutional performance. It could be excellent, good, needs improvement, or poor. I just wanted to provide you with, a sample of the evaluation, because I think, if we are able to implement this at different institutions, it's going to have some relevance. I chose specifically this item that is a promotion of indigenous traditional ancestral medicine, and so I just want to go very quickly through it with you guys, so that you see what we're trying to do here. So the indicator is the support for indigenous communities to implement traditional medicine practices in their communities. We have the metrics, agency guidelines to protect, respect, and foster practice and expansion of traditional medicine methods in indigenous communities, grants or resources allowing indigenous communities to implement the traditional medicine. Those would be the metrics, and the scoring would be as follows. For high, we would have existing policies and resources. Policies such as, adoption of the declaration as part of the policies, or any other policies that deal with the representation of indigenous people at the high level, administrative, managerial level. So high point would be the existing policies. Medium 2 points would be for some institutional support or resources. Sometimes agencies do have some, initiatives that, approach indigenous peoples, not fully, but they have some of the support or resources available for indigenous traditional medicine. Low would be minimal awareness about the need to support indigenous traditional medicine, and very low would be no resources and no awareness at all. So we have 20 items like this that go from, institutional policies to nature-based solutions, etc. Basically analyzing, how institutions do in health or around health, but also focused on many other aspects of life, because for indigenous peoples, health is connected to everything that deals with well-being, from economic opportunities to nature, to everything that surrounds an indigenous lifeway. So that is the sample that I wanted to provide you with, and I think this is the last slide. Kitty, I think we have one more with the QR codes. So we have here the QR codes for the three studies that you can actually download, and I think that'll be it for me. So thank you very much.
Thank you very much, Alejandro. One of the things I just want to acknowledge also is, so if with regards to the working group, it looks slightly global north, one of the things that we're very respectful of and understanding is, and it's very noticeable at the UN, with the Permanent Forum, not all Indigenous people are safe to speak. And so one of the things why you're seeing people from Australia, New Zealand, and North America involved in speaking is that we speak from a place of safety compared to the majority of Indigenous people globally. So if you're from Mesoamerica, it's not always a safe place to say the simple things that we're alluding to, even from a research place. So we stand and make those comments from a relative safety of coming from the nations that we are. Okay. Emma, did you want to make a couple more comments, and then I've got a couple of questions.
Look, I just want to recognise the incredible amount of work that Alejandro and the others have been able to produce in a very, very short space of time. And I think this again is that, I think we all understand and talk about the nature of relationships and partnerships, and I think that these pieces of work really hark to the time that we spend on the relationships and the partnerships. And again, the relationship between the Federation and the IDHA, the IWG, is really about the time that we have committed to each other in this relationship, and knowing that we each hold different strengths in the space and how we can share the space and share each other's knowledges and promote each other's knowledges so that we can see more change happen faster the way that we need it to happen. And I just would like to acknowledge Alejandro and Jeffrey particularly, because I'm fortunate enough to have my name go forward to be nominated for the United Nations Permanent Forum this round. So we're not sure how that's going to go, but there are 4 of us from the Indigenous Determinants of Health Alliance, as I understand it, Alejandro, who have been nominated from various parts or various regions of the UN. So again, this is another exciting space that's happening for us as we work together and grow together and share our various spaces with one another. So I think that's what I would just like to add to the end of that particular piece, and I'll give it back to you, Adrian.
Thank you. So as Emma's alluded to, this is all about relationships. One of the things that happens when you become a kind of a working group or a newer space in bigger organizations, as people, particularly those from the global north, tend to ask you to kind of do things. We call it the fixing it up all of a sudden. And so one of the things we're just recognizing is that this is a new space within this organization. And as Emma's alluded to, the fact that the Federation is leaning into it says a lot about its appetite to go to those places. So we're also careful not to just be the go-to answer for everything, but we're also making sure that we're present to receive those kind of questions. So it's not like there's a big pill to fix the Indigenous stuff. It's been waiting a long time, and actually this is reflected in now 2 of the most significant people in health on the planet. For the last 4 years in a row, the Secretary General of the United Nations and also the Director General of the World Health Organization, both of them have talked about the importance of traditional knowledge globally and leaning into these relationships with Indigenous populations and whatever that kind of means. So what I'd like to do is actually just simply ask both of our other panelists, where do you think we need to go to within the next couple of years? Where to from here now that we're gathering momentum? And so it's already been mentioned that there's an appetite to move in and support this Indigenous space. Where do we go to from here? Also, been recognizing that there are other right-moving tensions within the world at the same time.
I think there's a couple of things. I think what I've been talking about, how we continue to lean into the commitment to one another and how we share the space with one another is really important. It's centrally important right now because of the political nature of everything around us that seeks to divide us, and we need to do the opposite. There are also significant needs and opportunities to create and support greater capacity development within our Indigenous peoples, communities, in all kinds of ways. But that also means that we need to be able to be sharing the spaces in order to be able to be sharing resources and growing more resources as a collective global community. And I'm not saying that that hasn't happened previously, but I don't think it's happened in the way that we're experiencing it happen now. And I think, again, unfortunately, because of the political environment, it's actually encouraging us to do that better and more. And the other opportunities are, again, it's about connecting. So I'm involved in another space, which is another ally space, in recognizing the need for all of the networks that we have around the planet that kind of consistently do these really good things, but they do them in pockets, to be better connected to each other in real time. And so how do we create movements that are able, have the right knowledges and are resourced in a way that we can ensure that we are all connected up in real time better, so we can get more done more efficiently, but ultimately with the goal of really decolonizing mindset across the planet so that we can actually see better decisions get made that move around the political determinants that often we have no ability to change, because we know that there is significant numbers of our populations that are committed to good and true and authentic transformation. They just don't get to speak to each other as much as they need to. So there are a number of movements that have been fashioning themselves in that way. So looking out for those and becoming parts of those movements, I think are, again, centrally important to the future success and the speed of the change that we can see made. Those would be some comments I'd make to that question. Thanks, Adrian.
Alejandro?
Yes, thank you very much, Adrian. So yes, I agree with Emma. I see a lot of opportunity. There are many opportunities at the global and national and even at the local stages or scenarios in order to advocate for Indigenous rights and public health. I also see that there is the system in general, I think, for a long time has not included Indigenous people. So the challenges we face are big as well. So that takes coordination, speaking, with one voice, as well as, just the coordination of the synergies that we're doing. So I do see a lot of opportunities, and we're facing political times that require for Indigenous peoples to get together and try to, do things in a coordinated fashion. Either at the health scenarios or arenas, or connected topics like biodiversity or climate change, since everything is related to health. So I do see a lot of opportunities, and just staying together and speaking with one voice, I think, would be a good strategy to follow.
Yeah, nice. And
thanks.
also,
I'll just quickly, can I just quickly add something? Just that Alejandro just sparked off. And it's about the shared, it's the shared space and all the things, but also shared language. And so I think what I'd just like to highlight is that we made a conscious choice to share language with the Indigenous Determinants of Health Alliance in our work in our space, because it makes sense for us to all be speaking the same thing so that we can get more traction. Because I think that, again, a lot of us that are in this space and on this webinar tonight, and the audience even, know the difficulty with the confusion for those that need to understand what we're on about. So if we can have more agreement about the language that we're using, the way that we're describing the things that we're talking about, then we will have more success in having those people that we need to understand us most really get the message. So there's just to kind of add to what Alejandro said there.
Yeah, actually, if I may just follow up very quickly on that. And I think it is very important that in general, the public, the audience, understand the uniqueness of Indigenous health. One of the reasons why this framework, the Indigenous Determinants of Health framework, was created was because in many occasions, there were many other vulnerable populations that were grouped with Indigenous peoples. But Indigenous peoples approach health in a different way, as well as have different rights. So I think just educating the general public about the need to, work with Indigenous peoples in a unique fashion based on the rights of Indigenous peoples, as well as their cultural uniqueness. I think that is very important.
Nice. That's really good. So look, one of the questions that's come through from Chris Webber, but before that, I'll just be Mr. Context again, just acknowledging that there is an appetite, the extraordinary tapestry of the landscape of various jurisdictions. And so one of those things that for those of us who have populations that are quickly moving to 20% of our national population, that says that we have kind of influence. That number in Central America is probably only 3 to 5%. And so just want to acknowledge, for those of us in the global north, for many other places where Indigenous people are, the countries that they're in are going through military junta as the priority. Some of them are fossil fuel rich, but unable to tap those. And some of them are cartels for other drug situations. So already, the place and status of Indigenous people is about number 7 to number 20 in that space. So I think we're doing incredible things in the kind of being able to move in and influence in some way and being invited with regards to an appetite. So because we're in the West, we're able to progress these things in a space using the research from people that are on board here today, using the knowledge and action from even medical officers. I see we've got Rachel Ayres on here today as well. So let's just use those connections through our space. So Chris, the question that you've asked is, are there any updates on the global plan for action and situation analysis on the health of Indigenous peoples, like a scoping review? And I know some of that's been touched on, so I'll hand it back to our other panelists.
I'm giving that one to Alejandro.
Yes, definitely. Yes. So we actually had a discussion with the unit at the WHO about this. They're going to be presenting, they're going to have a side event about the updates on the situational analysis, as well as the next step for the global plan of action. I understand that they are reviewing the last draft of the situational analysis, and they will be incorporating that as part of the global plan of action. I do know they are facing a lot of challenges because of the global political situation in terms of financing the next steps. But I understand that they keep working on it, and hopefully at the forum, we'll have a better understanding on where they are. That's what I know. Yeah.
So maybe the answer all there to Chris is also at the end of April, we might have a few more answers around that as well.
Yeah, and quite significantly, Indigenous people, as I've mentioned, live shorter, sicker lives, and the conditions that shortens their lives are absolutely preventable. And so, particularly, so those again 2 windows of what that looks like. Those of us in the West, and just a wee statement for fellow New Zealanders around what's regarded as race-based funding. Actually, we talk about the fact that these shortages are moral imperatives. So we fit in there anyway, because our shorter, sicker lives are based on moral imperatives as much as anything, and not self and looking after each other, individualism. Okay. So reflecting on the theme of this year's Global Public Health Week, the Federation has supported the conversation around public health and decolonization, which is fine. Can you talk through our audience about what are the unseen things that have enabled this to be possible? Unseen things that have enabled this to be possible.
Yes, thanks, Adrian. Yes, and saying that also, I don't know if I said at the very beginning, but we've got 80 events across this week that are focused fully on decolonizing different areas in regards to health and well-being of our population and our public health community, which is absolutely fantastic. And I think, Adrian, what you're alluding to is that our staff in our office in Geneva, there are no Indigenous people in our staff group, and the fact that they have, really understood the importance of the subject matter and actually chosen themselves to make this the theme of Public Health Week, I guess empowered by the work that we have been demonstrating and educating them in, has been a really bold and I just say heartening move to see that this decision was made and that it's been taken up with such vigour by the rest of our public health community by having, as I said, 80 events, and that's just across the Federation events. I also would like to acknowledge, Adrian, since you brought it up, that I was actually supposed to be on another webinar right now for the Public Health Association of New Zealand, and unfortunately because of this clash I was unable to attend it. But again, a significant number of events happening just in New Zealand alone for Global Public Health Week, and some of them focused on this subject matter too. So these are just some of the things that are going on. Thanks, Adrian.
Nice. Alejandro?
Right. So, Adrian, you were asking about what to do in the Global Public Health Week?
Yeah.
That was the question. So we're going to be working with the Planetary Health Alliance on different aspects of it, including something that deals with the requesting a moratorium on the Arctic sheet for no activities, no commercial activities there. And so we're going to be collaborating with them in these regards. That's what we'll be doing.
I might just actually, just since you brought the Planetary Health Alliance up, I might just like to highlight them because it's a really important part of this conversation. I know we've both touched on our partnerships, plural, that we have, or partnership with the Planetary Health Alliance. So they organisation that is based out of Johns Hopkins University, and I'm very pleased to say that they're working relatively closely, I think, with the Indigenous Research Centre based out of Johns Hopkins as well. They have really, again, as a sort of ally organisation, shall I call them, lent into their responsibilities and obligations to Indigenous populations by developing these various relationships. So the Federation has actually had a partnership with the Planetary Health Alliance for some years, and in the last year and a bit, we have reinvested in our relationships with each other, which includes our relationship with the Indigenous Determinants of Health Alliance. And so both of us working sort of in different spaces in those relationships, but also collaboratively. And one of the number of things that we have been working on together has been the creation, or the possibility of the creation, of an Indigenous hub for the Planetary Health Alliance. And another significant event that we've been able to be involved in is the Oceania Planetary Health Forum, which was held in Fiji in February. And now that's a significant piece of work driven by Professor Aaron Jenkins out of Perth and Fiji. And he's been doing a lot of work in the environmental space, particularly to do with water and water, but also highlighting the needs in the Western Pacific region that are significantly ignored in all spaces and places where decisions get made. And so we were able to be on the program committee of the Oceania Planetary Health Forum. We were able to be present, and I gave a keynote speech, and Adrian and I also gave a workshop on behalf of the Indigenous Determinants of Health Alliance and the World Federation and the Indigenous Working Group. And be able to again grow some more networks and considerable impact points, and be present at the launch of the Oceania Planetary Health Research Centre at Fiji National University. We also committed that we would create a policy position statement on the Western Pacific region and the state of, or the the lack of the state of good environmental health in the Western Pacific region, as well as promote the call for action that was to come out of that particular meeting. So again, just another one of the pieces of work that many people probably don't know is going on in the background, and to highlight the Western Pacific region. So Adrian, back to you.
Yeah, thank you. Yeah, that was a very important forum that we were able to attend. Again, an opportunity to be with scientists, with people who are from the Pacific. And my bias, of course, is that, and some of you have heard me say, 1/3 of the surface of this planet is the Pacific Ocean. It's the largest single organism on the planet, and it's flanked at the top by all the forest trees that go around the Arctic Circle. In that circle alone, 1 in 4 trees on this planet are in that part of the Arctic Circle, and they reconnect through that flank, the Pacific Ocean. And so we see ourselves as Indigenous people within there, in the most sparsely populated place in the world, as guardians in whichever language that we use for that. And so we charge everyone from Tierra del Fuego, as we face that map, all the way around, up to the Bering Sea, down Kamchatka, all the way to where we are in our sub-Antarctic islands, to be guardians in terms of those coming from the global north to take up that place. Because the reality is, health is relative to what our planet is going to look like in the next 2 generations alone. And so the suggestion is that we know what's required as Indigenous people. We haven't moved from that place of the last 150 years alone, as the transformation from the Industrial Revolution has what's pivoted in the global warming alone. But our notions haven't moved or changed in that.
I have another piece to add to your first question, actually, Adrian, when you asked about, what is the future, I guess something like, what does the future look like, or what are future things that need to happen in unison with what's already going on. And I just wanted to, given that I've recognised the Public Health Association of New Zealand during this call, and that we are the World Federation of Public Health Associations, and that is civil society, the importance of the role of civil society right now and going into the future, the ability for us to be advocates and be louder and stronger in voice is really centrally key to keeping the noise on public health, on keeping the noise on Indigenous health in a way that many other organisations are unable to do because they are held by political constraints. The Federation is not. A civil society is not. And so just to encourage those people that are parts of organisations like this, that you have a really important role to play in advocating for the things that we know need to happen in a way that so many others can't right now. So just wanted to make sure that method.
Yeah. Which moves into the challenge. So as Emma's kind of alluded to, the World Health Organization and the UN are under attack at the moment. So part of the geopolitics of that is can I just, and it may seem that I'm stepping outside of the bounds of this particular conversation. So one of the things presidents and prime ministers are told when they enter the role, they're often told, particularly in the United States, there are 5 questions that you can't ask publicly. And that's because we're going to tell you what the answers are. And so since World War II, the sheriff on the planet has been the United States. So if the 19th century belonged to the United Kingdom, or Britain, the 20th century belonged to the United States. So they became the sheriff post-World War II. To maintain that place, they essentially have funded most of the United Nations and the World Health Organization so that they can influence over half the countries of the 200 odd countries in the world. Most of those are developing countries. That's how that kind of diplomacy works. To be honest, the other way it works is you fill up an airplane with cash through the CIA and turn up. And so that's how it kind of works. So when President Trump said he was going to withdraw, China immediately moved in and said, we'll replace that money. So historically, that was about keeping communism out. But what it actually means now is the work that's been done by the UN and by the WHO, for those of us who are of that age who have marks from vaccination and immunization, that's the kind of work quietly behind the scenes, and not just a polio, but arresting a number of the curable diseases and then the preventable diseases through public health. So many people now are coming to terms of what this looks like. And so the place is under attack politically and under attack from people who probably know less about the importance of having these organizations. That does not mean that the United Nations and the World Health Organization can't be under scrutiny, and it should be. Also, it moves at glacial speed. So when we talk about the rights of Indigenous people through New York, it moves at glacial speed, really. So that's kind of the lay of the land as how we kind of see it. All these roads lead to health and wellness. Can I also just acknowledge some of the questions that comes from some people, not just for us in Aotea New Zealanders? How is the work that you're doing benefiting our people? Part of my response is, it's not, but it is. That part of our role as leaders is to give, and give in a place in terms of manaaki. And I love the way Emma describes manaaki. So I might get Emma to do that. And that our role as leaders across the planet is to manaaki others who need support and help using the opportunities that we have to be able to do that. Would that be okay for me to get you to describe your manaaki piece, Emma?
Sure, no problem. So I guess when I'm working with groups of people and helping them to understand how they can be better at what they do, which is really about how they share space and how they share power and make sure decisions are happening in the right way. The word that we have in our culture for giving or hosting or taking care of others is manaakitanga. Mana is power, authority. Aki is to raise up, and tanga is to make something happen. And so I actually prefer to describe it as giving without expectation of return, because if you give to others with no expectation of return, then what does come back to you is even more honouring of the fact that you have chosen to give without expecting anything back. So giving without expectation of return, manakitanga in all things. Thanks, Adrian.
Yeah, no, thank you very much, everyone, for being here with us. I just want to reiterate that there is great opportunity that we can do in order to advance Indigenous rights in health in other realms as well. And I appreciate everybody's partnership and opportunity. The situation that we're facing here in the US, it's a little uncertain, but I appreciate leaders like Emma and Adrian from other countries who can help us take the voice. So thank you, everyone. And yeah. I mean, you all.
Again, this is a long journey. It's an easy journey also, but it's not a journey not travelled. And so I think leadership in the space is very important. So everybody here and everybody that you have an opportunity to influence are leaders in our space, whatever that represents to us all. I'm reminded that during the global lockdown, during that slight period, there was a time when the whole of humanity, particularly in the global north, had a space of returning to that space that belonged to our parents and grandparents, that actually we were slightly siloed in a village. And I'd like to just give a wee example of some of those things that happened during the first Ebola outbreak in Zaire, which has now returned to being the Congo. One of the things that the West learned was that villages, and you can imagine during the Ebola outbreak, the incredible challenges that people saw from what people was happening for them, bleeding from various RFI. It shocked the world. What was amazing is that each of the villages did what they'd done for hundreds of years. Each of them locked down and took care of their own people. They also, no one could go through the roads. They prepared the place that they would bury their dead. They had a central place for their food, and they looked after each other, and they bravely did that. Those are traditional values and opportunities for people to come together and do those things, which is ironic, because part of the reality is a lot of television today and reality stuff is kind of a roundabout stuff around defending and not actually looking after within our communities. So that's one of the things that gave us an opportunity during the global lockdown. It gave those of us in the global north to actually sit and communicate with our families electronically or otherwise, with our neighbours, to slow down a wee bit. It cleared the sky for a few months. It reduced the number of fossil fuel and petrol parts into our environment. So we slowed down and rested a wee bit. Those are the thoughts of our people traditionally anyway. And so those are some of the things that I think we can rely on and come back to. So a thing that came out of SARS-CoV-2 and COVID-19, and an opportunity for us to reconvene in this public health space. So again, I want to thank in Geneva, Maria from our office. Look forward, I'm sure Emma will mention, see some of you who might be at the World Health Assembly in May. So we'll see you in Geneva. Thank you, Kitty and Penny. Kitty out of New Zealand and Penny out of Australia, for all the incredible backup stuff that you're doing and your own leadership in the space. And now I hand it back to Emma Rawson Patu, the presiding member or the president of the Federation.
Kia ora, Adrian, and thank you very much. You've really made most of the acknowledgements that I would need to make, but just again to thank us all for being able to be here and to contribute to this important conversation, and not just the conversation, but actually solutions to how we enable this work to happen. Again, yes, I would like to particularly thank Kitty and Penelope for all the organising, all the hard work to get this together. Really, really appreciate that, because it's very difficult to do it with. We don't have huge capacity, so really grateful for that. Excuse me. Adrian has kind of alluded to some of what I was going to say in terms of my closing comments. One of the opportunities that I have is I get to sort of travel the world and talk to people about valuing Indigenous intelligence. You know, people come up with all these new terms and these new phrases for what they see as bright and shiny new ways of doing public health, One Health, universal health coverage, planetary health even. And I do have a laugh with our mates at the Planetary Health Alliance about, you know, actually welcome back to the knowledge that we've always had and always known. And so really just it is an opportunity to remind people of where most of this knowledge about taking care of one another and taking care of the planet came from. It came from Indigenous people. So I'm going to read a poem just to finish us off instead of doing the traditional karakia or blessing. So this is a poem by an elder from Australia. His name is Uncle Wesman, and the poem is called Indigenous Ones. Indigenous people from this earth's lands, now it's time for us all to join hands, to let the world know that we are still here. Let's do it now, for this is our year. Let the world know that our culture's alive. Let the world know that we have survived. Let them all know that we are still strong. Let them all know that we still belong. While there are still voices to tell our stories, and there are still ears to hear, while we are singing our ancient songs, they will all know that we are still here. While we still do our dances, and while we hunt our lands, then no one can take our culture from all our strong joined hands. Let the old ones tell the stories. Let the young ones hear and yearn to hear more of our days of glory and to listen